Welcome to Sex on the Floor podcast. This podcast was created to help educate the public about problems with sex and intimacy and how this is tied to both physical and mental aspects. Hosted by myself, Dr. Molly Hart, a passionate pelvic floor physical therapist and owner of Pelvic Balance Physical Therapy, and by Dr. Katie Schubert, a phenomenal sex therapist and owner of Cypress Wellness Center. We are here to have a good time. We're here to keep it real with you all and to educate along the way. I'm so excited for you to join us. We strive to help many relationships prosper in fun, safe, and healthy intimacy. While listening to the show, please remember that this information is not meant to diagnose or treat any medical conditions. Please speak with your medical provider for all things related to your healthcare. Hello all, welcome back to Sex on the Floor podcast. We have a special treat for you today. Of course, we have our amazing Dr. Katie Schubert, but we also have a special guest today, Carly Cuco. I'm saying your name right, last name right, correct?
It's pronounced Cusco, actually.
Oh, gosh, Cusco. I should have asked before we started. So Carly moved here in the St. Pete area back in November of 2023. I recently met up with her and we had just the most amazing talk ever. Her personal experience is what made me really want to connect with her more and bring her on. I'll let her tell her own story, but as far as she's going to be able to be relatable to you as the listener who maybe is having sexual health problems. And then she's also a medical professional. So hearing it from both sides and her having experienced her own personal struggles is so enlightening because you don't meet many people who have both of those viewpoints and lenses. So anyways, Carly, thank you for being here today. And I'll let you kind of introduce yourself and talk about what your background is in the medical field, and we can take it from there.
Yes, thank you so much. I'm so happy to be here. So just to clarify, I'm a licensed professional counselor, which is, I'm licensed in the state of Texas, and that kind of equivalent in Florida is the licensed mental health counselor. Because I know all of those things get super confusing, but I am licensed to treat folks in Texas and in Florida. And so I do sex counseling and relationship counseling. And I do think that my personal experience has totally made my work the most I don't know. It's just been the most valuable thing probably for my training that I've had, is the personal experience I've had as a client in sex therapy and, being on the other side. So it has been really an amazing journey.
Yeah. So tell us what brought you to Florida, and also what's the name of your company? Because you're treating online. That's why she did Florida and Texas. So what brought you to Florida?
So the beach. We'll just short and sweet. That's why I'm here. Yeah. And my practice is Carly K Counseling. That's my handle on all my social. It's my website, carlykcounseling.com. And I take clients in Florida and Texas, and all of my work is virtual. Awesome. I see individual clients and couples relationships.
Beautiful. Love it. And where are you treating from? Are you just treating out of your place that you're staying in right now?
Yeah. So I have a little home office, and that's where the magic happens. Yeah.
That's cute. I feel like that's what everyone's doing now, is their home offices. I love it.
That's pretty nice. I'll say I'm usually wearing sweatpants. So if you're my clients out there listening, yeah, you know what's going on.
They're like, we're wearing sweatpants too. It's fine.
Just trying to be relatable.
So Carly, when we met, where do we meet? At Craft Cafe. It's the most delicious place ever. My favorite place to meet up in downtown St. Pete. But we were talking and Carly started telling me about how she was married and what was going on with that. So do you mind sharing what we talked about at our little date?
Let's just dive right in it. Yeah. So I was married. I grew up in Oklahoma, And so I was in sex therapy and marriage counseling and all of that when I was married, which was when I was 22 to 25, and divorced in January of 2020, which was an very interesting year for everyone. So that was very traumatic. I think, it was definitely the product of growing up in a very conservative community where, at Oklahoma State University, where I went to college, it was more normal for people to graduate engaged than it was for you to graduate single. It felt like it was just very much part of the culture. And so, I married someone who I'd known through from high school. So, it wasn't necessarily like, oh, you rushed into it or you didn't. But mainly, I think just when you get married so young, there are just so many things that you haven't grown into yet. And I think we realized that in our marriage, and it was really, really hard, like it is for a lot of people, I think. So, issues with sexual dysfunction came up right away, right away. And, I ended up learning that that was mostly related to the conflict and the lack of emotional safety in that relationship than it was to my actual body and like a physical kind of etiology. And so what ended up happening was I treated it medically, put my body through all kinds of, honestly, what I look back on and feel as torture,
Yeah.
to then get to the end of it, become, get divorced finally after years of therapy and physical and pelvic floor PT, and for those issues to disappear. Now,
Yeah.
I want to be very clear when I say that like, I don't know that that is a common experience. My sexual dysfunction was completely related to being in a toxic relationship. And so it's not that like that's the cure if you're experiencing it. There's so many different causes for sexual dysfunction. I just happen to be part of the group of people that are impacted by sexual dysfunction kind of purely from the psychological impact, and have that slip through the cracks completely in all of the work I was getting through sex therapy, through pelvic floor PT. And, nobody was pushing for that or looking at that. And so it ended
Nobody
up.
related that. No one said, hey, your relationship dynamics are playing a factor in why you're having this pain with intercourse. No one said that.
So this is the tricky thing is I think, looking back, some practitioners would mention, like, are you happy in your relationship? Are you? And as a professional, we know you have to walk a line of trusting what your clients are telling you, and also recognizing that they're paying you to see the blind spots that they might have. They're coming to you because for a reason, right? And so, like, I think I was also just kind of, when there's any type of emotional abuse in a relationship, there's usually some type of like power dynamic.
Mm-hmm.
And often, a victim of that dynamic will take a lot of the blame, and they've been kind of socialized or they've been treated enough to the point where they believe, it's all my fault or something. And so when they would ask, you know, I took full responsibility and I'm like, no, this is like my thing. This is something I need to fix. And nobody pushed back against that. And so I think, something that the way that I use that in my work now, when I ask people, I don't ask them, does your partner pressure you and make you feel guilty or guilt you into having sex? I will ask them, do you ever feel guilted or pressured? Just like that teeny tiny language shift can change so much, because people will really be protective over their partners, even the abusive ones.
Yeah.
And so important to kind of use language that isolates it to their personal experience so you can kind of peel back some of the layers. But it's very complex. And so it's understandable how things slip through the cracks, of course. It's just,
Yeah.
this is something that's very important that, doesn't get enough attention.
Yeah, it was so interesting when you shared your story, because I personally think there is always a factor of the relationship dynamics when it comes to pain within our course. I have never worked with one person ever where I'm like, this is only a physical problem. Not once. There's just so many complexities to why we have pain, both emotional and physical. And pain is something that's really mainly generated by the central nervous system. So, like, yes, the peripheral nerves down by the vaginal tissues can be hypersensitive. Yes, there can be hypertonicity. All these things can be playing a factor from a physical standpoint. But what is happening in the central nervous system, the autonomic nervous system, that's generating a lot of the patterns that we're seeing in this over processing of the messages, there's just so much complexity. So if you don't look at the full picture of how the nervous system is being affected, you're never going to help. You cannot help somebody.
Yeah.
It's not one thing. That's the thing that's so funny about pain, is people think physical pain. I'll differentiate physical pain. People think physical pain is only a tissue injury, like a tissue issue. And I'm like, it's not. No, physical pain is still a nervous system issue. It is now, it always will be. That's what we know from the research. It has nothing to do with the tissues, which is like crazy. The tissues are a factor. I shouldn't say it has nothing to do. The tissues are a factor. They're one piece of the puzzle of how we are experiencing things in life as far as pain goes. So that's so sad to me that you went through all of that, and then you get a new partner or you leave that relationship and you're like,
Yeah, I do. I think I really have to, I've had to grieve what I went through that, just that process specifically of like, I was dilating using a dilator. So I had vaginismus. And so I was using dilators like on a daily basis, essentially, like, which and putting my body just through this
torture.
I mean, it's trauma. Yeah, it's torture. It feels like torture. Putting my body through so much. I ended up doing the Botox injections, which helped the physical tension, right? But it's just
Your
for
pelvic floor PT did tell you you have hypertonic pelvic floor muscles. Did they tell you that your pelvic floor muscles are too tight?
Yeah.
Okay. So that was a factor in what was going on. You did the Botox, and then I'm sure they gave you like a protocol afterwards. You use dilators.
Yeah, I was using the Pasic glass dilators, which was recommended to me by my, physician and all of my gynecologist. And so it was incredibly painful. Certainly doesn't encourage intimacy, I would say, when you're doing that on a daily basis. But I think back on that, and it makes me really sad that it could have been avoided with someone who was a little bit more attuned to the emotional issues that were going on.
Yeah. And even just the process of what the therapy you went through. Like, I don't use dilators. The only time I use dilators is if somebody had radiation or chemotherapy and there truly is, and the vaginal canal is completely atrophied away. And the other times I use dilators is actually with my younger girls who have a non-perforated hymen, and their hymen is so thick. It's so ridiculously thick at the opening, of course, only, that you have to use a dilator because it's a circumference. But everything internal, once you get past that opening into the vaginal canal, I hate dilators because I'm like, I like to use the pelvic floor wand because I'm like, I really want to get into the nooks and crannies and give more space and opening, but it's one area at a time. So it's not so intense and so traumatic like the dilator is. And you also then, the way I think about it is you're making each one of those areas can handle more pressure and more movement than the penis will ever create. So by the time we then go to have intercourse with the penis, it doesn't affect it in the same way. But dilators are also they're just so weird to put in the vaginal canal. You just like put it in, you let it sit there. It's just a weird experience. Whereas when we're using the pelvic floor wand, I'm having them spatially map out the pelvic floor area, which is very important to healing for the central nervous system as far as pain goes. Having a spatial map, they go around to the clock, they do diaphragmatic breathing with it. There's a whole process, again, mainly targeting that the central nervous system has to feel safe. There has to be a lot of different stimuli coming in that make the central nervous feel safe while you're doing it. But if you're going home every day using a dilator, to me, you're just re-traumatizing
Yeah.
both the tissues and your central nerve, like your relationship to your vagina. It's like torture. And I don't know why doctors, like if anyone's listening who is a provider that does this, please stop just giving out dilators. Like, just why are you doing that? And then if you are, please don't use the glass or the plastic ones. There's really nice ones. What's the brand I always use? Pelvic. Oh, I'm brain farting on what it is. That's okay. I'll talk about it here in a little bit. But I'm so sorry you went through that. I get mad about it. I honestly, like, I passionately get mad about it because of the amount of women who have come to me and this is what their doctors prescribe. I mean, God, even Moffitt, who's a great hospital, this is what they do. If they've had radiation, they'll send them home. I've had so many patients, they'll send them home with these like shitty ass plastic dilators. Like, here, just go home and use it. And then so now these women are like, it's my fault. I didn't do the dilators. They put all this guilt and blame on themselves because now they have pain with intercourse. And I'm like, why are we setting women up for failure after this? Like, no, you should have prescribed them to go to pelvic floor PT after this. You don't just send people home with these plastic dilators and be like, good luck.
Right.
Sorry.
I also unfortunately think this is another example of where just a complete lack of knowledge and understanding about, the vulva and our personal anatomy and desire and arousal and what that looks like. I mean, the research we're doing now is, just now kind of expanding to a point where we know a lot more. Dr. Lori Mintz, if you're interested in learning more about more of the statistics, is my favorite kind of one-stop statistic
What's her
shop.
name? Dr. Lori.
Dr. Lori Mintz. She wrote the book Becoming Cliterate. And so she does a really amazing job educating people about the vulva and just anatomically and with pleasure. And I think, that is such a huge conversation. We cannot skip this aspect of it, that if you don't talk about, no, none of my practitioners, my sex therapist, my gynecologist, nobody said anything about pleasure. Nobody even mentioned pleasure. So how would that, and this is all, it's also very penis focused. Everything that we're discussing, dilators are penis focused. It's like, here, do whatever you need to do to accommodate a penis. Instead of let's try or let's explore all of these other ways that we can experience pleasure, all of these other ways that you can feel intimacy and connection in your relationship. If none of those things feel natural either, maybe there is something else that's going on that doesn't have anything to do with your body and like what it's capable of accommodating. And so I think pleasure needs to be a part of the conversation, and just understanding, like we're just, Dr. Emily Nagoski's book, Come As You Are, explains the dual control model of arousal really well, which talks about how, if you feel like you have a low sex drive, the chances that you just have a lot of sexual breaks are really high. So it might not be that you just don't like sex or you're not interested in it, but that the context isn't right for what you need and what you want in a sexual situation. And so none of that was discussed with me. I remember one thing that my sex therapist did with me. I'm telling her all about this stuff and my pain and, how badly I wanted to fix it, and how I started having, because it was so painful, I started having this like physical reaction. I started having dreams that I was being raped. I had this like physical response anytime he touched me. Like, ugh, my body was just like, and, the direction she went with that was to help me relax with his touch. Like, so she gave me like techniques to try to like kind of calm myself down and relax instead of really investigate why is he causing you so much tension? Because sometimes it can truly just be like our body has now paired pain with this person's touch, and we have to kind of disconnect those things, and that is definitely a part of it. But we also need to explore emotional safety in relationships, which is totally just completely skipped over so often. And so looking at that, that's how I've kind of, all my personal experience has, influenced the way I practice, which is that I practice kind of with a triangle method, kind of like Maslow's hierarchy of needs. At the bottom of the pyramid, you've got like physical safety. Then we've got emotional safety. We have to make sure. So in my practice doing sex counseling, we've got to make sure we're physically safe and comfortable, then that we're emotionally safe and comfortable before we even start sex therapy. And so before we even start sex counseling. So basically, and then at the very tip of that pyramid, the very, very tip, all of these different pleasure, kinks, eroticism, desire, all fantasy, all this other lovely, exciting exploration. Sometimes people come to seek out sex therapy because they want to get to that thing. And we have to start at the bottom of the pyramid. And so that's what I love, is really making sure that like we have developed emotional safety in a relationship before we start talking about, okay, now let's desensitize this person's touch, because I feel confident after my own assessment, after doing this relational work with communication, all these other things, that both parties feel like they can communicate safely, feel heard, and feel safe with even just expressing other desires and fears and concerns that aren't sexual in nature at all, because that is so much more vulnerable. And so I've had so much success kind of using this model.
Yeah. Now, here's what I'm thinking, because I agree with everything that you're laying out, and especially the priority of what, like, the foundations that need to be addressed first. What I wonder though, because I think about people who come see me, and you were saying how they want all this up here, and I do my intake with them, I realize there is a lot of issues with just the way they're even presenting why they're coming to see me. I can see through it. I'm like, okay. And they're not there for themselves. They're there because this is a huge portion of my population. They are there because their husbands are at a point where they can't take it anymore. The not being able to have sex. They just can't handle it. It's affecting the relationship. So they're coming to see me and they're like, my husband's saying like he can't go any longer without having sex. I have to work on this. And I'm like, okay. And then they also want a baby. Like, this is an example. I really want to get pregnant, can't have sex. I'm like, okay, so you really want a baby, but for your husband, this is more like he just really wants to have sex. Yes. And am I afraid he's going to leave me? So like they're in this kind of panic mode of, I'm going to lose my husband if I can't have sex with him. And so then I'm like, I will tell them there's a lot going on. This is something I really would like you to go see Dr. Katie about. We're going to work on the physical aspects of what's going on. And because your goal is to have a baby, I'm going to help you to where you guys can have sex and have a baby. Like, I can help you with that. But I was like, but there's a lot of other stuff going on right now that we're not going to address in pelvic floor PT. And I'm like, I really would love for you to go work with couples counseling or by yourself. You guys pick, you can do it individually and then bring your husband in as a guest. I'm like, and I'll say this every appointment, every time we keep going over it, they won't do it. They won't go do it. And so then we do get somewhere, like they're able to have sex eventually, but are they having pleasurable sex? No. And I ask them every time they come in, are you happy with this? Is this the sex life that you want? No. I'm like, what do you desire then? And they're like, I would like to be able to have pleasure. I'm like, okay, so we got to do something to get to that point. Nothing's changing. I was like, in fact, you're really just traumatizing yourself every time you have sex like this. And so again, I'll mention, like, can you please book an appointment with Dr. Katie? If not, like, we can do another therapist. I'll help you. And then they don't do it. So it's so frustrating because, like, I agree with what you're saying of all of these things, but it takes a certain person to be willing to work on the foundation and actually build up a healthy relationship. And not everyone wants to do that. It's like, I just want to have sex enough to meet that desire and then put it over in the corner.
Yeah.
It doesn't affect our relationship and we can stay married. Like, that's how I view it.
I tell a lot of the couples that come in with these like primary sexual complaints, I tell them, look, I know that you're coming to see me because I'm a sex therapist, but in my experience, it's never about the sex, right? Like we're sex therapists, but it's never about the sex. And typically the first thing I'll ask them to do as we're trying to investigate like what the real issues are is to stop having sex. I'm like, let's just stop having sex for a while so that we can peel back the layers here and see what this is truly about, because this is about something other than, vaginas, penises, sex. This is about something else. We need to figure out what that is before you guys keep doing the same thing that you're doing and causing more harm to your relationship.
Yeah. That's the thing. I do the same thing. I go, when you come to see me, and most couples follow, most women that I work with will follow this, but I have some where they're like, my husband will never go for that. So I'm like, hey, let's wait at least 6 weeks, please. Like you guys can do any type of intimacy you want. I don't care. Like have fun, explore, do things you haven't done. But I was like, we really have to make sure no penis goes into the vagina because it's causing trauma every time. And I give them an example. I'm like, have you ever ate something that made you sick? And they're like, oh yeah, one time I had shrimp and it made me sick. I'm like, have you ate shrimp again since then? No, I hate shrimp now. I'll never eat shrimp again. And I'm like, exactly, because your nervous system, it's great at storing memories. And now it knows shrimp made me sick. Now, logically, we know shrimp doesn't make you sick. Logically, we know shrimp's a great, delicious food, but you won't eat it anymore because your brain has that association now. I was like, so every time you have sex, it's like you're eating shrimp over and over again and it's making you sick. And I was like, imagine you did that even 5 times, how much just even the sight of shrimp would repulse you. And I was like, that's what's happening with your partner. I was like, so you guys are continuing to do this and you're actually making things far, far worse from a nervous system perspective. And so they're super happy to stop. Normally, if some women are like, no, my husband will never go for this. He'll say no, he won't pay for the treatment if I tell him that. And I'm like, okay, like I just work with them where they're at.
And that's a really great example also of how something that could maybe start out as physiological could turn into something more psychological, right? Like getting food poisoning is a physiological thing, but then it turns into something more psychological where, you're looking at perfectly good shrimp and you can't eat it because like you have this memory of it.
Yeah. And I think a lot of dyspareunia, vaginismus is like an older term now, but dyspareunia is more of an updated term. I think there's no way in the world that you can say it's just physical or it's just mental. It is always both. I think it can start physical, like a hypertonic pelvic floor, more sensitive, and it turns into a serious psychological issue, which why would it not? And I think it can also start with serious safety issues in a relationship, emotional safety, physical safety. And somebody who, and this I know happens because I have patients who've never had pain with sex and they get with a partner or after childbirth develop it, not from a pelvic floor injury, but because their relationship dynamics drastically shift after having a baby. And then all of a sudden now they have pain with sex with their partner, but their partner also isn't doing shit to help with the baby. And they're both working and the woman is just drained and exhausted and they really resent their husband. And I'm like, yeah, your vagina, your vulva tissues, they don't want anything to do with your husband. And I'm like, and rightfully so, nor do you. Like, you don't even want to touch him because he's not helping. Like, you're drowning and he's just over there floating on a boat. Like, this is really the problem. So, anyways, yes, it's a good point of bringing that up, Katie, is like it can snowball into both categories.
Yeah, and so that's what I hear what you're saying too about, when my clients are coming to me with this very specific concern, we want to meet them where they're at. If they have a hard time understanding the connection between emotional safety and sexual pleasure, and they want to skip to this place, there's only a certain amount of accommodating that desire I can do as an ethical professional. And so, I mean, everything I do is I want to try and explain this to the best of my ability and give you really, really specific goals. I think that this is, a part where lots of people leave couples therapy really unhappy is they go and they sit in this room and they bring up these conflicts and they don't really know where they're going. Like they have no idea what's the goal. Like, what are we doing? I don't want to just go and talk about my problems in front of another person. How is this helping me? And so I see that all the time. People coming in and be like, we did this 5 years ago and it didn't work. And now this is our last ditch effort. Hopefully you can help us. And that's how I always just start is like, okay, this is I talk about my little model and talk about like, this is where we're going. This is what I want to see before we take the next step. and this is how, I want you to be looking for those things and how you can tell, and this is how I can tell. So we both like, this is your therapy, but I'm also need to take some ownership for how I am the professional in the room. And so we're just going to do this together so you feel like you have ownership, but you also feel like you're being led. And
Yeah.
so we will take those steps. So I'm not going to jump straight to, if you're having sexual pain and you come to me and you want to just like get these techniques to calm your body down so that you can have sex, I'm not going to do that first. I'm
Yeah.
just not. Because that is, exactly like you were explaining earlier, I don't want to make the problem worse. And that's exactly what that's going to do. So all I can do is explain, hey, this is what we're going to do. It's not going to last forever. I promise you, we will work our way over there, but we have to start here first. And I need you to trust me that this is like how we're actually going to get to the root of the problem and get you some sustainable effort or some sustainable change. I think I also explain it like when you're doing a remodel, Katie, you can probably speak to this yourself, but like doing a remodel,
Messy at first.
you mess it all up and it looks a little scary. You're kind of just like, oh my God, like what is going on? You don't get to jump from a vision to the final product. You don't. It's a process, and recognizing that, but also preparing people. If no one told you, hey, we're going to knock all this down and it's going to look crazy. No, if no one told you that and you just walk into your house one day and see it, you're going to run away scared. Like, what the heck just happened? Instead of like, this is exactly what's going to happen.
Yeah.
This is what we're going to do. And this is what it's going to look like at this stage. And this is what it's going to look like at this stage. So you're absolutely prepared. You know what you're getting into. And like, you feel like you also have some control in the situation and like, where you're going. I think that helps people so much. Have faith in the process is like, not just asking them to trust you blindly, but to show them like, this is the process. This is why it works. And this is where we're going. And like, that's helps so much.
Yeah,
Hey,
absolutely.
question for you. Can you hear the leaf blow in the background or no? No, thank
No.
God. Away. I love that you said that. When I first started treating, people would come to me and they would just would want to book one appointment or here and there because people want a quick fix for everything, right? I mean, that's what the whole medical system is based on. You come in, let me give you a pill for this. So I stopped offering that. I was like, no, if you want to come work. So now if people come to work with us after your eval, we lay out the plan of care and the time frame and how many appointments. And that's just to, some people actually do completely get better in that time frame. I would say actually majority do. Some don't. I don't know how many barriers are going to be. I met you one time for your eval. But they have to, if they want to start treatment, they have to commit to a minimum of an 8-week plan of care and a certain amount of sessions. And some people, not often, but some people kind of resist that, like, well, can I just do one point? I'm like, no, we don't do that because it's a waste of time. It's a total waste of time. And that's honestly just going to traumatize you. So you're going to come in and you're going to get pelvic floor work done. I'm going to be all up in your vulvar tissues for like 1 or 2 appointments just to get nowhere. Like this is just going to cause more trauma. So if you want to do this, I am there with you. I am your teammate. Like, let's go. But we have a lot of work to do and we have to be committed to the whole process. Otherwise, please just don't do it. Like don't. That's like, Katie, like why are you talking about remodeling? You're not just going to tear up your kitchen and then let it sit there for 4 months, right?
Oh yeah. I mean, the thing, it's very similar with therapy too, right? Like, we're both saying that there are underlying emotional and physical things going on when a couple's not having sex, or if the sex that they are having is painful or icky in some way. And a lot of couples want to come in like, oh, let's just come in like once every 3 weeks, once every month. But like in that beginning process where you're peeling back the layers to figure out what's truly happening, it takes more intensive therapy. Like you need to see a couple weekly for a while before you can make like an accurate assessment about what's actually happening in the relationship. And then once you do that, once you have like a firm understanding of like what's happening in the relationship, why sex isn't the way that they want it to be, then you can spread out the therapy But
Mhm.
without that more like intensive therapy, it's really difficult for therapists to get a good handle on what's happening in the relationship.
I agree.
Absolutely.
But I like that you said, Carly, that you're very upfront about that in the beginning and lay out. I think as long as I wish more providers did that. I wish more providers like, hey, we need the intensity in the beginning and it's going to be a process. And I say that to people. I'm like, please, I need you to trust me. I'm like, you came to me for a reason. Like I have over 100 5-star reviews for a reason. Like, look at my reviews, look at the testimonials. Like, I need you to please have faith in this and let's work together. Because if not, we know as a therapist, we're not helping them. And so it's hard for me at this point in my career where I just won't continue on because I don't know what to do then at that point. I'm not going to just charge somebody to come in just to get nowhere. I mean, I guess you could still make money that way, but are you helping anybody? No. And for me as a therapist, that's the most frustrating feeling in the entire world.
Absolutely.
I hate that the most, I would say, as being a therapist is knowing you're not going to be able to help somebody
Hmm.
because they're just not at a point that they need to be at to do the commitment and understand like what the process that needs to occur, unfortunately.
Yeah, and the thing that comes up for me, right, as you're saying that, are the amount of times I've had clients, often women, come to me by themselves and present this issue, and I tell them, this is a couple's issue. And they say, well, my partner isn't willing to, do
Wow.
that. And I say, okay, then this is what we can work on then. So I've had several clients come to me and say, I have this sexual pain, or my partner says I'm terrible in bed. I need help. What do I do? And so with those clients, I tell them just like really openly, this is a couples issue. And so this is what we would do in couples therapy. Because your partner is not willing to come, this is what we could do in individual therapy. These would be the goals that we could create ourselves, which would be exploring yourself, understanding your own desires, understanding your own sexual history and eroticism, and like also looking at self-esteem and looking at expressing your needs in a relationship and some like things like that. We can work on that. I would love to support you. I'm never going to say hands off because you don't want to do this exactly the way that I would. I'll say, I want to be here to support you. Our goals are going to change if your partner isn't willing to come in with you. And so I do think that's how I hopefully can keep buy-in for folks, is like, even if it doesn't look exactly like what you wanted it to look like when you come in, if you have a good understanding of what it will look like, and also make sure there's a foundation for them to voice their concerns, or to voice like if they feel like we're treading water, we're stuck, or they're not getting really helpful stuff out of our sessions. I want to create a space where they can be open and honest about that. I think that in itself creates a lot of emotional safety within the therapeutic relationship, where they can trust. Because in asking for trust, in the first session, I meet someone, I understand that's incredibly vulnerable. And so the way that we can also build trust is by, if you're uncomfortable, if you love something that we're doing, and you tell me, and I can prove to you that it's a safe space to do that, then, we'll be able to work our way quicker to our goals. And then, the other thing I wanted to mention as well is like, it's different for everyone where you're at in that pyramid, or where you're at in your relationship. You're going to have different sex therapy or sex counseling. Like, you're going to get different information, or not different information, I guess, but you're going to be at a different spot. So,
Experience, probably though.
yeah. And so, like, I think when I say all this, I also have couples who come in who have no conflict, essentially, who just want to like spice up their sex life. And I still kind of go through and really, peel under the layers and make sure there's emotional safety there. Sometimes we do a couple communication things here and there, but then we do get to jump like right to the tip of the pyramid. But
Yeah.
it was like we did have to just like do a quick checkup and make sure, and then we get there. So it's not, I want people to feel confident too. When you're going in, you're going to get the services that you need.
Yes.
Might
Yeah.
not look exactly like what you think at first, but just, try and trust the process.
I think that's the point is like, yeah, what you think you need and want when you're working with a good therapist is they'll hopefully be very transparent about what the goals will be, what's realistic, and what the process is going to look like. Because we often do know what needs to be focused on. That's not maybe what the client came in asking for, but it's like to me, I view it like being a good parent to my kids. Like, okay, I know you want chocolate every single day, but like I can't give you chocolate every single day. Like we have to help guide along the way. So I love that you're saying all that. And yes, there's so many. I work with a lot of couples that have, I would say, the most incredible relationships, so much safety. God, their partners are just phenomenal. They come to the appointments, they're so supportive, and watching them be able to have sex is, I don't watch them have sex, but watching them express how they are able to have sex with one another and pleasure with one another, and the text messages I get from them randomly where like I never thought I'd have this experience with my husband. Those are, it's so fulfilling and rewarding. So yeah, the experience you're going to have with your therapist for everybody is going to look different. And hopefully if you find a therapist that you trust enough, based on, hopefully you look them up and have looked at their reviews, hopefully you trust them enough that to listen to their guidance, and hopefully they give a plan, like you're saying, because not everybody does. So any things that you want to wrap up with, Katie?
No. I do have to run. Our vet just showed up. But our veterinarian, we're veterinarian construction workers. We have a full house.
It's like, wait.
I know. My head's spinning, and it's only Monday. I will say we talked about this briefly before we pressed record. But if you are looking for a good sex therapist, there are multiple ways to find one. The laws are super funky though, so I'm gonna try to make this very simple. So in the state of Florida, we have certified sex therapists, and we also have sex counselors, and then we have ASECT sex therapists, which is a different credentialing. And to be a certified sex therapist, you have to have a year of postgraduate study in specifically sex therapy. Now, Carly's on the student track to become an ASECT sex therapist. Is that correct?
So I am on the certified sex therapy track for Sexual Health Alliance.
Yes. Okay. So you will be a sex therapist in a few months?
Yeah.
Okay. Okay. So she will be a sex therapist in a few months. But not every state protects the label of sex therapy as much as Florida does. So if you are in Florida searching for a sex therapist, you'll get the same thing every time, pretty much. ASECT also offers a sex therapy license that's national. It requires a little bit more diligence early on in your schooling career to get it. But ASECT has a website, and you can search for sex counselors, sex educators, sex therapists, or you can go on Psych Today and search for sex therapists.
Yeah. Is it, what did you say? What did you say?
Psychology Today. Yeah.
Psychology Today. That's what I use when I'm with patients and they've been resistant. I'm like, are you open to us doing a search and sending a message? And I like let them choose. I'm like, what filters do you want to put on here?
Yeah.
And then you send little messages, and I'm like, maybe just try to help.
The great thing about Psychology Today is you can search based off of like whatever insurance you have. You can find sex therapists that take UHC, or sex therapists that take Aetna, or that are like local to your area if you want to see one in person. It's a really easy way to search for a therapist.
It's awesome. And you can put whatever filters you want. You can typically see pictures of the therapist. They normally have a little summary of themselves. I have found that has been a way to help build the confidence and trust when I'm working with individuals who I'm like, gosh, therapy would help them so much. I have found if I bring that up in our sessions at the end, I'm like, are you willing? If they say yes, like maybe I shouldn't be doing that, but I do. I want individuals so badly to understand the need to go to therapy, but for whatever reason, there's sometimes just such a stigma behind therapy, especially sex therapy. So, but they're wonderful if you're dealing with any sexual dysfunction at all in your relationship. I don't care even if you think it's just dyspareunia and you think it's just a physical issue, like please consider working with a sex therapist. Just do your research, find somebody you vibe with. You got two wonderful ones right here, just Florida and Texas. Well, thank you so much for being on. This was a wonderful episode. I hope the listeners enjoyed it. We are going to have Carly on again in future episodes. There's some other really awesome topics that she wants to discuss with our listeners. We wanted to just give you an introduction to her today and kind of her background story, but be prepared to listen to some more fun, spicy, juicy, fun information from her. So have a good rest of your day. Bye.
Thank you.
We are Dr. Molly Hart and Dr. Katie Schubert, and you've been listening to Sex on the Floor podcast. We really hope that you enjoyed this episode. If you have any questions and want to get in contact with us, you can follow us on Instagram at Dr. Molly Hart and at Dr. Katie Schubert, on Facebook at Pelvic Balance PT and at Dr. Katie Schubert. And for more information about us on our websites, you can find us at pelvicbalancept.com and at drkatieschubert.com.